Which assessment finding indicates fluid volume overload? A. Dry mucous membranes. B. Bounding pulses. C. Hypotension. D. Decreased urine output. Correct answer, B. Bounding pulses. Rationale: increased volume leads to strong pulses. Strategy: volume up equals pressure signs. Question 27. Which ECG change may be seen with hypokalemia? A. Peaked T waves. B. Flat T waves. C. Wide QRS. D. ST elevation. Correct answer, B. Flat T waves. Rationale: hypokalemia flattens T waves. Strategy: potassium affects rhythm. Question 28. Which intervention reduces afterload? A. Diuretics. B. ACE inhibitors. C. Digoxin. D. Fluids. Correct answer, B. ACE inhibitors. Rationale: ACE inhibitors reduce systemic vascular resistance. Strategy: afterload equals arteries. Question 29. Which nursing diagnosis is priority? A. Risk for infection. B. Impaired gas exchange. C. Chronic pain. D. Risk for constipation. Correct answer, B. Impaired gas exchange. Rationale: pulmonary congestion compromises oxygenation. Strategy: ABC priority. Question 30. Which symptom indicates nocturnal worsening? A. Dyspnea on exertion. B. Orthopnea. C. Paroxysmal nocturnal dyspnea. D. Fatigue. Correct answer, C. Paroxysmal nocturnal dyspnea. Rationale: sudden nighttime dyspnea is classic for HF. Strategy: night symptoms equals HF red flag. Question 31. Which medication slows disease progression? A. Furosemide. B. Beta blockers. C. Nitrates. D. Morphine. Correct answer, B. Beta blockers. Rationale: beta blockers reduce sympathetic stimulation and mortality. Strategy: slow the heart, save the heart. Question 32. Which assessment should the nurse perform first? A. Auscultate lungs. B. Check oxygen saturation. C. Review labs. D. Obtain history. Correct answer, B. Check oxygen saturation. Rationale: oxygenation is priority. Strategy: airway and breathing first. Question 33. Which finding suggests effective therapy? A. Decreased BNP. B. Rising creatinine. C. Increasing edema. D. Decreasing urine output. Correct answer, A. Decreased BNP. Rationale: lower BNP reflects reduced ventricular stress. Strategy: trend BNP. Question 34. Which electrolyte imbalance is common with loop diuretics? A. Hypernatremia. B. Hyperkalemia. C. Hypokalemia. D. Hypercalcemia. Correct answer, C. Hypokalemia. Rationale: loop diuretics waste potassium. Strategy: loops lose K. Question 35. Which patient is at greatest risk for HF exacerbation? A. Controlled hypertension. B. Recent MI. C. Young adult. D. Athlete. Correct answer, B. Recent MI. Rationale: myocardial damage reduces contractility. Strategy: weak pump equals HF. Question 36. Which symptom indicates worsening pulmonary edema? A. Productive cough with pink frothy sputum. B. Dry cough. C. Wheezing. D. Chest pain. Correct answer, A. Productive cough with pink frothy sputum. Rationale: classic sign of pulmonary edema. Strategy: pink foam equals emergency. Question 37. Which action is most important when administering 4 diuretics? A. Give rapidly. B. Monitor BP and electrolytes. C. Encourage fluids. D. Limit bathroom use. Correct answer, B. Monitor BP and electrolytes. Rationale, risk of hypotension and electrolyte imbalance. Strategy, safety with diuretics. Question 38. Which diagnostic test confirms reduced ejection fraction? A. Chest X-ray. B. ECG. C. Echocardiogram. D. BNP. Correct answer, C. Echocardiogram. Rationale, echo measures EF directly. Strategy, EF equals echo. Question 39. Which teaching helps prevent readmission? A. Skip doses if nauseous. B. Avoid exercise completely. C. Follow low-sodium diet. D. Drink fluids freely. Correct answer, C. Follow low-sodium diet. Rationale, sodium restriction reduces fluid retention. Strategy, diet matters. Question 40. Which symptom reflects decreased cardiac output? A. Warm skin. B. Bounding pulse. C. Confusion. D. Hypertension. Correct answer, C. Confusion. Rationale, poor perfusion affects cerebral function. Strategy, low output equals low perfusion. Question 41. Which medication increases contractility? A. Digoxin. B. ACE inhibitors. C. Beta blockers. D. Diuretics. Correct answer, A. Digoxin. Rationale, digoxin is a positive inotrope. Strategy, dig equals stronger squeeze. Question 42. Which sign indicates fluid restriction effectiveness? A. Dry mouth. B. Reduced edema. C. Hypotension. D. Tachycardia. Correct answer, B. Reduced edema. Rationale, less edema shows decreased fluid overload. Strategy, look at swelling. Question 43. Which condition often precipitates HF exacerbation? A. Dehydration. B. Infection. C. Hypothyroidism. D. Anemia. Correct answer, B. Infection. Rationale, infection increases metabolic demand and fluid shifts. Strategy, stress worsens HF. Question 44. Which nursing action prevents skin breakdown? A. Fluid restriction. B. Repositioning. C. Oxygen therapy. D. Daily weights. Correct answer, B. Repositioning. Rationale, edema increases risk of skin injury. Strategy, pressure prevention. Question 45. Which medication should be taken in the morning? A. Beta blocker. B. Diuretic. C. ACE inhibitor. D. Digoxin. Correct answer, B. Diuretic. Rationale, prevents nocturia. Strategy, timing matters. Question 46. Which finding indicates worsening right-sided HF? A. Crackles. B. Ascites. C. Orthopnea. D. Dyspnea. Correct answer, B. Ascites. Rationale, fluid backs up into abdomen. Strategy, right side equals body swelling. Question 47. Which lab value reflects fluid dilution? A. Elevated sodium. B. Low sodium. C. High potassium. D. High calcium. Correct answer, B. Low sodium. Rationale, HF causes dilutional hyponatremia. Strategy, too much water equals low sodium. Question 48. Which instruction is most important for home monitoring? A. Check BP monthly. B. Daily weight tracking. C. Weekly lab tests. D. Annual echo. Correct answer, B. Daily weight tracking. Rationale, early detection of fluid retention. Strategy, daily habit saves lives. Question 49. Which sign indicates poor prognosis? A. Stable BP. B. Rising BNP. C. Weight loss. D. Clear lungs. Correct answer, B. Rising BNP. Rationale, indicates worsening ventricular stress. Strategy, BNP trends matter. Question 50. Which outcome best indicates readiness for discharge? A. Oxygen saturation stable on room air. B. Mild crackles present. C. BNP elevated. D. Edema unchanged. Correct answer, A. Oxygen saturation stable on room air. Rationale: adequate oxygenation without support indicates stability. Strategy: stable breathing equals safe discharge. If you made it through all 50 questions, you're operating at a high-level NCLEX mindset, the level where most candidates struggle. These weren't just questions, they were traps designed to test your ability to prioritize, recognize toxicity, and act fast under pressure. Remember this. The NCLEX is not about memorization, it's about clinical judgment. Stay sharp. Stay focused. And I'll see you in the next video.